Welcome to COVID Talks. I have the pleasure to have with me Dr. Kate Baddock. Dr. Baddock is the chair of the New Zealand Medical Association, and she is also a family physician in Warkworth, New Zealand. Good afternoon, Dr. Baddock.
Good afternoon.
We have seen that the pandemic spreads to everywhere, and it has also reached the Southern Hemisphere. Although New Zealand so far hasn't been hit that hard, currently reported there are 868 cases, and unfortunately one person deceased from COVID-19. So what is the situation in your country? How do you see the pandemic coming to New Zealand?
Wow, it's really very interesting. So out of those 868, 13 are in hospital and one is in ICU. So almost everybody with it is in the community. We opened up yesterday to a looser definition of case definition. So now there is a deliberate attempt to not just swab those that we expect to be positive, which are mostly travellers and close contacts of travellers, which constitute approximately about 90% of our cases. Only 8 are confirmed community transmission, and so really the object at the moment is to find out whether we do have a lot of community transmission or very little. And the reason that's really important is because now 8 days ago, we went into complete lockdown. We were one of the countries who did it the earliest in our trajectory of cases. And it was an extreme measure done quite deliberately to stop the spread, because there's no way that our health system would be able to cope. We have something like 400 ICU beds. So we needed to be able to not overwhelm the hospital system. So we went into complete lockdown, and in New Zealand that means everything is closed. Restaurants, cafes, theatres, all sports clubs, all sport codes are not doing any sport at all. We have no universities, no schools, no gatherings of any kind. You can't have more than 2 people together on the street, and they have to be what is called in New Zealand in the same bubble. So they have been self-isolating with a group of people, which is normally their family, and that bubble can move outside for exercise, for essential services such as food, and to go to the medical clinic if required. Otherwise, they're expected to stay at home. And this is being rigidly enforced by the police, and the government has been given emergency powers to manage this situation. Interestingly, there is a COVID select committee been appointed by the government, and it's headed by the leader of the opposition, I think, in order to indicate that this is a cross-government initiative, and to keep the government honest. They've been given a lot of power in this situation, and by putting a leader of the opposition in charge of the committee, it just helps keep the whole process a bit more transparent, I think.
Kate, most of the countries in Europe, also the United States, have seen that they are short of supply for personal protective equipment, but also ventilating machines and other stuff that is necessary for the treatment. Is that something that New Zealand is suffering from as well?
About 2 weeks ago, primary care was looking at a shortage of PPE. And what happened is that the national reserves were mobilised and distributed from the centre at the same time as, I believe, 7 flights of COVID equipment came from China. So there has been a steady stream out into the community over this last week, which has addressed any risk of limited supplies, which we did not actually experience. It is made a little bit more coordinated here by the use of community-based assessment clinics known as CBACs, where all those who are suspected of having COVID are being directed by general practice, mostly, so that the PPE gear can be used by the same individual for an entire session, as opposed to when we see them in general practice, where we're not in PPE and we have to put on PPE just to see that individual and to swab them appropriately. So, which is a much higher use of PPE than in the CBACs. So there was a deliberate move to direct people to the CBACs so that the continuity of equipment and supplies was less constrained. And as I said before, we only have 13 people in hospital right across the country. And so there is no demand currently on hospital equipment or facilities.
Is there a projection that this number may go up? And are there plans to, for instance, reduce elective treatments and free hospital beds for COVID cases?
This is already done in preparation for such an overwhelming need, as primarily because of other countries' experience. There is no elective surgery, has been none for a week. There are no outpatient clinics in person. There are some being done virtually. There are no new referrals to the hospitals being accepted. So the hospitals have absolutely shifted their focus to COVID-19, have rearranged their hospital structures, their infrastructures and their functions, and moved some hospital services to other hospitals in order to free up facilities just for COVID. So, yeah, I think that all went, the planning has been going on for the last 2 to 3 weeks, and as of earlier this week, all hospitals in New Zealand were ready, prepared and waiting. In terms of the numbers, for the last 5 days, we have had a 48-hour increase of 1.2 only. So no doubling over every 48 hours. The worst we got to just before we went into lockdown was 1.6. And since lockdown, it's been at 1.2.
Now, does this shift also produce kind of extra burden to family practice? Do you see more cases you have to take care of now?
Must be now 11 days ago, the Royal New Zealand College of General Practitioners put out a recommendation to all GPs to please move to virtual consultations. And that came out on a Saturday. By Monday, over 70% of all consultations taking place in general practice were virtual. We have moved almost entirely to e-health consultations. Nobody is issued a prescription or a laboratory test in the surgeries. It is all faxed, old but reliable, all faxed to either pharmacies or to the laboratory testing centres. I see, like I was consulting all day yesterday, I had something like 35 consultations. Of them, I saw 5 face-to-face. The other 30 were all virtual. It's not as satisfactory, but it is certainly fulfilling the need until such time as we can get back to normal.
Mm-hmm. New Zealand entered this whole pandemic business with a short delay that may have to do with the fact that you are still in summer or in fall now, which also may mean that your curve is behind and you still see an increase over time. Are there any thoughts for specific protection of vulnerable groups, especially the elderly, of which we know that they are hit most hard by the pandemic?
Because everybody's in lockdown, that includes all people over 70, but everybody is in lockdown because our 20 to 29-year-olds are about 25% of all cases because they're the group who were travelling, who brought it back with them from overseas. And so because a quarter of all cases are in that age group, there is a huge drive to protect those who are most vulnerable. So we have a lot of community setups where people are delivered meals to their homes, where they have people to do their shopping for them. There's a lot of online shopping occurring now. And we have families, communities, and I call them rescue groups. They call themselves the caremongers, who are basically people who take upon themselves in communities to ring maybe 20 or 30 people on their list and make sure that they are okay in their self-isolation or lockdown. And the other thing we are doing with particularly all the high-risk groups, so that for us is the over 65s, all those with chronic medical conditions, we're just entering our flu vaccination program. And so for the first program, the healthy population, the under 65s with no other medical conditions, are not able to access flu vaccination. And they will not be able to access flu vaccination until all the vulnerable groups are vaccinated. So that is at least a protection against what we are also going to see moving into the winter.
A last question, which refers to the fact that New Zealand is the holiday paradise for many people in this world. We have seen figures that there is a 5-digit number of tourists still trapped in New Zealand. No flights in, no flights out. Are they looked well after?
So when we first locked down, we had something like 250,000 travellers in New Zealand. And for New Zealand's 4.5 million, that's an overwhelming number of people who don't usually belong here. We had some 25,000 or so New Zealanders also overseas at the same time. So what has been happening over the last 2 weeks, as those New Zealanders are brought home, we are moving people back to their own countries as well. Like just this morning, there was a German flight that took about 250 Germans back to Germany. Whilst they are here, they are being looked after. They are made sure that they have somewhere to stay and that they have meals and so on. Their main complaint seems to be a lack of communication. But honestly, they must be subject to the same communication as to the rest of New Zealand, which is that every day the Director General of Health does a public release of everything up to date, along with the Prime Minister, and that has been every single day.
Dr. Baddock, thank you very much for this talk. I wish all the best to New Zealand, and let's hope that the curve doesn't incline that much further.
I sincerely hope so. We have to wait a few more days to find out.
Thank you.
Okay. Thank you.